This morning, pregnancy after adopting. Infertility can cause anxiety and distress for couples, but sometimes after they decide to adopt because they feel there's no other option, couples find themselves expecting a baby. CBS News correspondent Michelle Gielen reports in our Medical Mysteries series.
Angie and Nick Kelsey of Twin Falls, Idaho, always knew they wanted a family, but it didn't come easily.
Hey, Phoebe.
It was just something we thought would happen naturally for us, like it happened for a lot of our friends. When we started to have problems, it was a big surprise for us.
The couple was surprised when they were diagnosed with unexplained infertility. At the same time, Angie's period stopped. Her doctors told her to relax.
It's just hard to say relax about it when, you're reminded of it every month when you don't end up being pregnant.
The couple tried fertility treatments.
It was just really hard for us, and I think more than anything, we just wanted to be a mom and a dad.
Remember this?
Angie and Nick decided to adopt.
You worry about your spouse. You don't want to see him go through so much heartache. And, so anything you can do to take away that heartache is great, And so adoption was a way that we could do that.
Incredibly, just 2 months before her adopted baby was to be born, Angie's period returned.
When we told people we were adopting and going through that process, people would say, oh, you're going to get pregnant now. And I thought, no way, because we've done fertility treatments. We've had everything in the perfect situation, and it doesn't work for us.
Angie was able to see her adopted baby Xavier delivered. The couple was overjoyed.
You just felt like he belonged with us.
And there soon would be more good news. Angie, infertile for 3 years, discovered she was pregnant.
I just remember laying in bed at night and just being able to see myself as a mom. This is really going to happen for me. And I think that for me, was a big change.
To this day, the couple is at a loss to explain the mystery of why they got pregnant after deciding to adopt. But doctors say Angie's infertility was brought on by the worry of not being able to get pregnant.
I think that is the one place where we can say the stress probably was a major factor in the infertility.
What are you doing?
In September, baby Xavier got a little brother, Cole.
When I started going into labor, I started thinking, it was bittersweet because I knew that I was going to get this baby, but I also didn't know if I'd ever get to be pregnant again. But it was a great time.
Hey, buddy.
Mr. Busy.
Michelle Gielen, CBS News, New York.
Joining us now are psychologist Alice Domar and fertility specialist Dr. Alan Penzias. Good morning to you both.
Good morning.
It seems like I hear about this happening all the time. Doctor, does it really happen that frequently?
Well, the reason we talk about it is because it's so uncommon. It actually is really newsworthy when somebody does this.
So you don't find this in your practice?
Not too often. Some studies have been published which show that only about under 10% of women who adopt go out and have a baby like this, which is about the same frequency we'd expect if they didn't do anything.
When it does happen, do you think stress is a good explanation of why?
Stress is a very good explanation, but there are many other things that we still just don't know.
I know that you studied the effect of stress on infertility. What did you find?
Well, infertility is very stressful. What she was saying, that your whole life is in an uproar. Stress causes the same. Infertility causes the same level of stress as cancer. 2 studies have now shown that infertility patients are just as anxious or depressed as cancer patients are. And if you can relieve the stress, then you can restore normal fertility, which is what happened with them.
So I guess the huge question here is, how do you relieve the enormous stress of infertility treatments?
It's not that hard. I think that the first thing is people feel so isolated, they don't want to talk to anyone, they don't want to admit they're stressed. But research has shown that interventions, like, I run a mind-body groups, and these restore their fertility. And so if you
What do you mean by interventions?
They come into a program where they learn relaxation techniques and stress management techniques, and they learn the lifestyle habits the physicians tell them, don't smoke, cut back on caffeine and alcohol. But they're also with other women who get it. And you can't underestimate that. I'm sure a lot of your viewers have been going through infertility, haven't told anybody. Yeah. But, being with somebody who walks in and says, oh, someone got pregnant in my office and I hate her, and the other people go, oh yeah, us too. It normalizes the process.
So many people who are suffering from infertility get this advice. People who say, just forget about it and it'll happen.
Makes me crazy.
You know, because sometimes you forget about it and it doesn't happen. So what do you say, doctor?
Well, exactly. I mean, in this particular case, it was remarkable that her period stopped. So any woman who especially notices any problem with her menstrual cycle or anything else that gives her a clue that something is wrong should have a full medical evaluation. And there are a number of very easy, inexpensive treatments available to help.
More alternatives than ever.
Absolutely.
All right, thank you so much.
Thank you.